Medical Dilemma.
Hi everyone, welcome back. You're still watching Medical Dilemma on GNN. I'm Attorney Sara Suguitan. Today we are tackling vaccines with our special guest, Dr. Gatchalian. And joining us are my co-hosts, Dr. Attorney Teresita R. Sanchez and Father Jerry R. Manlangit. All right, let's... Dr. Sanchez, you have a few words before we begin.
Sally is well known in the medical community. At
Mm-hmm.
because she's one of those giving the exams para kung papasa ka o hindi as a fellow.
Examiner pala to si Dr.
Administer. As Secretary of PPL. Ako lang po nag-administer. Hindi ako yung nagbibigay.
Anyway, she's also related to a celebrity. If can anyone guess here, we'll give her a special award. And that's not,
no
very
other
small.
than...
Smile, and probably they might guess.
Yeah.
Ganun, Father.
Yeah.
Right. Si Ruby Rodriguez.
Pero at least po
younger
mas
or
sexy ako
older? Okay. So, parang maganda.
Yes,
that's
so sabi ko kay
Thank you
Doctor,
po.
very, very beautiful. So, Doctor, let's go back to our topic, vaccines. But this, I would like to address a question to Father Jerry because we're talking about medical dilemmas. So, you know, abroad, it has been a controversy about with regard to the ingredients or the resources with which we put into the
Yes, right.
the vaccine.
I think Doctora will confirm that in fact there are vaccines that use raw material or things that we need in order to be able to come up with a vaccine. And is that true, Doctora? That
Opo, meron naman po. Pero these are like yung mga noon-noon pa na inano na nila, what do you call this, ini-develop na nila, hindi na yung mga bago na kukuha.
right?
So there are a few. Otherwise kasi, yun yung kailangan kasi sa cell lines eh.
That's right. And which also leads us to one of the controversial topics about stem cell using also embryo. Because the use of embryo is pluripotent, which means that it can develop to different lines.
Exactly, yes.
Okay. So, well, if that is the case, and for as long as the abortus has been collected in such a way that they were not intended to be aborted,
That's right.
and so happens that there were some, what you call when you are pregnant and then there was miscarriage, probably you can use that because you don't intend.
Yes.
But if you intend to harvest an embryo, which means that for the purpose of developing a vaccine, and that is where the moral controversy is, and I think that's also unacceptable, because while we try to help people in their health care, make them healthy, but we are also sacrificing life, and that is a no-no. We cannot sacrifice life to save another life.
So,
Father,
Father, that's where the controversy arises, because yung iba, you really do not know the source. And, sometimes people are tempted to produce or to deliberately have an embryo, deliberately abort in order to get that as a source of the
Precisely, that's the
vaccine.
controversy. And hopefully, and hope that the people who are producing these things, the vaccine, should have a sense of ethics, so that they will try to avoid these things, so that, while they are doing these things, they are on the ethical line.
So if you do not know, Father, where the source of the embryo is, but it's from an embryo, can
that's
you
right.
use it?
They can ask.
Can the pediatricians use it?
Well, for as long as it's already there.
Yes.
It is already there. For as long as there was no previous intention to harvest this, and they were still alive, and that is precisely where the problem is.
Father, as far as I know, hindi yon. If ever there is, if ever there's use of any of the abortus or embryo, these are not intended. Yung hindi yung just for the sake of no. So
And hopefully,
that I know for sure.
And hopefully that they are not also embryos that come from the excesses of IVF.
I know, Father.
Yes.
Very good. So
that could be a
we should
source.
be happy about that because we are on an ethical line and
That's right.
good enough. And we should even campaign for vaccines or inoculation.
Yes, Father, because it
yeah.
will really save lives.
That's right. That's
Vaccine
right.
saves lives. In fact, si Bill and Melinda Gates Foundation have
Right.
invested a lot of money because for him, he says that vaccines are a miracle.
Right.
Because since the implementation of vaccination, all vaccine-preventable diseases, diphtheria, tetanus, their incidence has dramatically and significantly dropped.
Right. As history would tell us.
Yes,
that
Father.
it has significantly dropped, and there was even one doctor who was trying to give false information about the ineffectiveness of
For example, measles, mga ganon, vaccines.
vaccine.
Yeah.
But actually, behind that, he was after some monetary
Oh, so you know the
consideration.
history, Father.
Yeah, so, yeah,
Well informed. Yes, since in fact, few years back, the journal, which is a peer-reviewed journal, medical journal, that actually published his results, has withdrawn his paper.
it's a good thing.
Withdrawn nila yung paper niya.
Siya ba yung nag-connect with autism?
Yes,
or what?
ma'am, and there is no relationship whatsoever. Because they tried to do a repeat study. And wala eh. Dapat kasi, to prove na meron siya, you should see this not only in just one study, you should be able to
Should be
repeat
duplicated,
the research. Yes, you
right.
should be able to duplicate. Apparently, there was none that was done. So because of these results, that there were no other studies that could give the same results, that we withdraw yung paper niya kasi it's...
And only that, his license was revoked.
Yes, Father, his license
Yan
was revoked.
dapat. Oh, yes.
And also the mother should be feel assured that in fact there is no, as Dr. said, there is no connection with autism and vaccine for that matter.
Yes.
Nagka-epidemic pa ng mga measles ata noon because they
We're
were
still
all
having,
not
we're still
immunized.
having outbreaks of measles.
Because of that.
Yes.
Yeah, because of the false information. Right.
What if an adult person approaches you, and never had any vaccination of any kind since birth? Do you have to give all of those, like the oral for
Not the
polio,
oral polio
all,
vaccine,
no
but
more?
measles, mumps, rubella, they can actually be given because there's a combined vaccine. It's called MMR, and it contains measles, mumps, and rubella. That can be given to adults.
the adults.
The varicella vaccine can be given to adults. There's a pneumococcal conjugate vaccine yung for pneumonia that is indicated for adults as well. And then yung influenza vaccine, yun, pwedeng ibigay sa adults.
But why not the polio? Because polio is also
If
deadly.
you were to give it to an adult, the recommendation is to give the intramuscular, yung systemic, not the oral polio.
But you still give all of those
Sa
dengue,
children, yes.
mga
But
ganon.
the World Health Organization is now moving towards the intramuscular polio, the inactivated polio vaccine. We call it IPV. And because we will not be able to eradicate paralysis or polio if we do not shift to the IPV. Kasi most of the vaccine-associated paralysis is due to the oral polio vaccine. So, pero sa Philippines, bihirang nangyayari yon. So, we still give, for now, we still give the oral polio vaccine. But on the third dose of the oral polio vaccine in the health centers, in our national immunization program, they give the IPV injection already on the third dose. So they give the oral polio and they give the IPV as well on the third dose. Kasi Father, mag-shift na tayo later on
Good.
to the IPV.
Oo, kasi may mga possible bad effects also of these vaccinations, right? As you have said.
Oh, no
can
vaccine
also
is completely safe or completely effective. So just like any other medicine, diba? Hindi
yes.
naman lahat 100% guarantee.
Yeah, but still the better one, the better
Yes,
choice.
better option.
I see.
Tell us, Doctor, about this new vaccine, which is the dengue,
Yes,
so
Father.
that the audience will also be informed.
Yes, Father. The dengue vaccine has been licensed in the Philippines last December. So it's now available in the private market, and the government will actually be implementing, starting this April, they will be implementing the dengue vaccine to grade 6 ba yun? O grade 4? Yung mga 9 years
Grade
old.
4?
Grade 4 ba
Grade
yun,
4?
Father? Oh. In 3 regions of the country. Region 3, Region 4A, and the National Capital Region. Because for the last 5 years, these were the 3 regions with the highest incidence of dengue. So ito yung pinili nila. And the vaccine has actually undergone many safety, very extensive safety trials. there were about, this vaccine is actually a product or a culmination of 20 years of research and development.
Right.
Which included the Philippines.
Yes,
I
and the
think we
Philippines
were-
was in fact included in the three
The
phases
test,
of the
oh,
study.
yeah.
So they also did extensive studies. Mga kanyan, Father, there are about 15 countries that were involved in about 25 clinical trials. And they have shown the vaccine to be effective. It decreases hospitalization in 8 out of 10 children and decreases the severity of dengue in 9 out of 10 children.
Wow. Oh,
Well,
because as of now, dengue, the victims can still die, right?
For
But with
ako,
that,
personally, I have a fight against dengue. Because
Why?
my daughter
Oh,
actually had dengue twice. And the second episode, Father, yes, I've been in that seat like any other parent across the doctor's table, you know, na, will my daughter die? You know, even if I was a mother then, hindi ako doctor noon, you know. So I have this personal vendetta against dengue. And her second episode was really very severe. She was
ibang
vomiting
strain
blood.
siguro yun, oo.
Grabe, so...
Kasi 4 ang strains natin,
Yes,
right?
and the vaccine can actually protect against the 4 strains.
Oh, that's good, that's good.
well, I had
Is it
myself
costly?
with dengue.
Ah, you did,
Even
Father?
in my adult life.
Siya
Oh, kasi Father,
Right, right.
it does not choose age, sex,
Right, right.
wala.
He almost
Any
died and he
religion,
wants
wala.
to be here, sana.
Blood platelets went down to as low as, I think, 20 or 30.
Oh my God.
Something like that. But afterwards, it just went up.
Oh, kasi Father, it's a viral disease, so it will spontaneously resolve. Ang importante kasi, they're able to manage you during the first 24 to 48 hours during the critical period. Kasi after that, tuloy-tuloy na yung paggaling mo whether you like it or not, tataas yung platelet mo But syempre, you wouldn't want your child to undergo that kind of,
Right, of course, yeah.
illness. So.
And
Is it
the stress
costly?
that you're going to have as a
Exactly,
mother.
Father. Grabe. The emotional, psychological
that's
stress. Oh my God.
And knowing for a fact that there are also children who die because of it.
Oh, yes.
Teka muna.
So there
teka
are
muna.
adults who die too.
And there are adults who die too. Oh, yeah,
Thank
right,
God
right.
you're still here. But are they costly? I mean, these vaccines.
The price, of course, is reasonable. Besides, we have to realize that the economic burden of dengue
Right.
in the Philippines is very high. For
Yes,
example,
yes.
they have estimated that we spend about 16.7 billion pesos because of dengue.
Just to eradicate those
Oo.
communities
Yes.
with them.
So we actually, we physicians, we pediatricians for that matter, recommend administering the dengue vaccine. It is indicated for children 9 to 45 years old. But of course, we say that this should be in conjunction with the ongoing vector control and community engagement programs. So hindi
Alright.
naman yung bakuna will eradicate dengue, no. Both the vaccine, vector control,
Yeah.
community engagements, plus the vaccine, hopefully will reduce the incidence of dengue in the country.
Of course, if they come from the government, it's supposed to be free,
Yes,
right?
yes.
Oo.
But only for, in the meantime, for those 3 regions lang muna.
Kasi,
And eventually, the government will expand coverage, yes.
Ang galing.
In fact, we in the medical community applaud the government for, putting the vaccine into the national immunization program. Kasi nga, iba yung burden talaga ng dengue. You know, I had a patient, Father, na diagnosed ko as dengue. Ang tanong sa akin, he was 7 years old, and he asked me, Doctor, will I die? So, di ba yung perception nila, pag na-dengue ka, mamamatay ka
Right.
Yes.
So,
And talaga may namamatay naman.
Meron.
Yeah.
Yung the stress is not only of the patient himself, no? The father, the mother, even the siblings for that matter.
the whole family, Father, talagang apektado.
That's right, and even the classmates sometimes. So it becomes a social thing, actually, And if you can prevent this, it's a milestone that there will be fewer people who will go into the hospital, and the cost will be reduced significantly. And certainly, it is something laudable, as you have said, laudable for the government to be doing this. And hopefully, they'll be able to cover all the regions. Okay, because
Hopefully, in the future, Father.
The entire Philippines, para we will be
Pero at
dengue
least
free.
now, yes ma'am, pero at least now they're covering the areas with the highest
Endemic
burden.
dun sa
Oo.
kanila.
For the last
Yeah.
5 years, they've seen these 3 regions to have the highest.
You know, we had a lot of cases, complaints, no, sa PMA, Philippine Medical Association before, of against pediatricians because their children, the patients died from dengue. Now with this information, at least they're now getting accepted na it can really kill.
Oo.
It can
Okay.
really kill.
Kasi kuminsan, no matter how aggressive, how early you diagnose, how much management and you do, there are a few patients na no matter how good the doctor, talagang will go eh. May mga ganun na
Baka
pasyente.
maraming toxins kaya? Why is it so?
Well, I
Is
guess
there immunity system?
well, sinasabi kasi namin, it's probably because of late diagnosis or late consultation. Kasi some, fever lang yan, baka trangkaso. Diba? It's like a flu-like illness. The symptoms are very similar to flu. So, late ang consult. That's why. But generally, if they come early, napiprevent mo naman. But sometimes, maski maaga, talagang, oo eh.
Who wants to lose his patients,
Exactly,
right?
yes. Oh my
Especially the
God.
babies.
Ako nga, Father, I always pray over my patients pag toxic eh.
Very good. Because according to studies, a doctor who prays for his patient is 32% more likely that the patient is going to recover.
Oh, wow.
There are so many studies, and even in Harvard, there is a study on
That's
that.
it, Father? Oh.
Yeah,
Prayer
Yeah.
and faith.
prayer and
Faith,
faith.
faith
He
in
prays
God.
always for the patient. 32% more likely you're going to recover.
At saka syempre, Father, ako rin, I pray for myself na, Lord,
Sure.
please give me the right to make me an instrument
Because you
of
know very well
healing.
that the prayer always creates always a positive element in us, and that positive element is good for immune system. No?
Yeah.
So you cannot just, for example, dismiss. No? Ay, di ka kailangan yan. Science doesn't have anything to do with spirituality. No. There has been studies, a lot of them, not only a few.
Oo.
And it has been proven. And that is one of the beautiful things there. Because, if you cannot do anything anymore, what else?
Oo.
How else are you going
Pray.
to do? And where else are you going to go?
And with that, Father, we will take a short break. Please stay tuned. You're watching Medical Dilemma on GN.
Medical Dilemma